Hi, I'm Samuel Carmona, a rheumatologist and internal medicine specialist. I think thermal imaging could be useful in rheumatoid arthritis, one of the main diseases in rheumatology. I live in Medellin, Colombia, a city with a population of 3 million inhabitants. I currently work in a clinical research center where we carry out studies of drugs and medical devices. It's part of the CCBR. To get it matter, one of the main diseases in rheumatology is rheumatoid arthritis. It affects 2% of world population and is characterized by attacking the joints, predominantly in the hands. So, patients show evidence of inflammation, and doctors look for these 4 signs: pain, redness, swelling, and heat. But in some patients, this examination is very difficult, and it's not easy to see the inflammation or feel the heat or feel the swelling. So we use other aids to make the diagnosis of active disease, and these are the images and lab tests. The problem is that if the laboratory tests are positive, confirm the activity of the disease, but if they are negative, do not rule it out. Then we use images, among which we have the X-ray, but it only shows advanced stages, changes in the disease. The MRI is more useful, however it's expensive and not readily available. So the ultrasound is gaining more interest in recent years, but it's because there is no other method images. Ultrasound is the technology with which thermal imaging will compete directly. However, it's expensive for rheumatologists and need training, which takes up to 2 years to obtain a certification. That is why its use has not been fully extended. So the thermal image is a solution to the problem because it's less expensive, easy to perform, and can be done directly in the office. Then, what should be done is to test the technology to better adjust the parameters to fit the medical needs. And I could adjust it by testing it in people with rheumatoid arthritis. And as soon as it meets the requirements, the next step is to start the phases for approval of medical devices in Food and Drugs Administration in the United States. This requires clinical studies in healthy subjects and then in subjects with the disease. Although, even if the technology initially failed, I'm sure it will arouse interest in medical societies and other groups begin to use it. Why in Colombia? Because we have experience, we have access to a large number of patients, more than 4,000 patients in rheumatoid arthritis, and last but not least, because it's cheaper than conducted studies in the United States. This is just the beginning. The thermal imaging has great possibilities to use in medicine, as in this article in which is tested for the detection of breast cancer. If you are interested, these are my contact details. Thank you for your time. I hope to see you soon.